intro.
Hello, people. We are back. It's been a long, long time. Some people
Yeah,
are
and thanks
upset
for
with
the
me.
love, guys. Everyone who missed us, that was really touching.
I know they sent hate messages to us. They missed us so much. we
Yep.
got hate mess. We got hate messages because we were talking Star Trek instead of Brazil Expat Journal. So we're back, and not only are we back, we have one of our favorite people back with us. And I told Pete, I said I only want to go back if it's with Rebecca because my July was spent mostly in hospitals. I had a very difficult July. So just very quick explanation of why we took such a long break, and then I want to get Rebecca on because she's not in Brazil and it's very late where she is, so we don't want to keep her on very long. But I do deserve, you guys do deserve having an explanation. Hi, Sid. There you go. Rebecca was asking who listens at 10 p.m. A lot of people listen, and other people listen on the playback. So there's Sid. How are you, brother? So we're talking healthcare today. An important topic. A lot of expats ask about. And in July, I had some serious stomach issues. I thought it was very serious. I had to go to a lot of hospitals. I had to get things stuffed in me, in my butt, in my throat. Anyway,
Yeah.
so that was heavy on my mind dealing with the healthcare system here in Brazil. And then other issues that are more personal with my little cousin and everything. So we just had to take a long break. I had to take a long break to just take care of myself. But I'm glad to be back. I'm glad to be back. Oh, I'm hearing a lot of feedback here from somewhere. I'm glad to be back. And I called Rebecca because Rebecca, I met her at the first time when we went to a congress in Brasilia about healthcare. It was about the Brazilian healthcare system. I think what's that noise?
That's that's Rebecca. I think.
Okay, yeah, they
I'm
keep moving all.
stationary. I'm a rock. I'm not moving
Okay,
at all.
so anyway, so guys, I met Rebecca in Brasilia, and she's a registered nurse. Okay, that's her main gig. Uh, and so I said, who better to talk to us expats about the Brazilian healthcare system, from the public system to the private system, than Ms. Rebecca Alatea, who is an author. She is author of, and I'm going to share this, Rebecca, and then I'll let you go on in a second because this is so cool. She wrote a book, and now it's in English, guys, and you can get it on Amazon. I'm going to put it right here. In English, it's called Right Living. Okay, Letters of a Black Woman Traveling Around the World. This is the English edition. And I'll put all these links in the comments, guys. As usual, you'll be able to find everything. And she traveled through cities, states, and countries like Tajikistan, Mozambique, Malawi, Tanzania. She's been all over. And she wrote letters to herself, okay, about her experiences and joyful, emotional, moving narrative in a very communicative and agitated way. I've been reading it. I got a copy of it in Portuguese, so I'm practicing my Portuguese with it. And if you want the Portuguese version, some of you expats need to practice your Portuguese. So I suggest you get the Portuguese version, which you can also get on Amazon right here. Um, and it's basically saying the same thing that was in the English version, just that in Portuguese is escrever. So I'll link all of that stuff in the comments, guys. Please check out her book, support her. She's a traveling woman, she's all over the place. So, Rebecca, long introduction, but you deserve it. How are you, my dear? I love you so much, and thank you for being with us.
Yeah, thank you. I've been speaking some Creole also, and we say thank you in Creole. Thank you so much for this invitation, and I also love you too much. For me, it's a pleasure to stay here with you and share a little bit of my experience. Thank you for introducing myself very well. Hello,
Perfect.
Peter.
Hello, glad to have you back.
Oh, very happy to have you back. So, Rebecca, let's get right into it, okay? So, first, am I correct? You are a registered nurse, yes?
Yes, I'm an infection disease nurse, and I have master degrees in the science health. That
Mm-hmm.
is about me, my profession, what I do for passion. I love also to be nurse like this. Yeah, and I building hospital around the world. Now I am in Sierra Leone. I just opened a maternity here, put some protocols on way, and in few days I'm leaving again to Brazil. Like my life is working half of my time with nursery, but managing and building hospitals, and now half of my life is traveling. Like I divide my life 6 months working with healthcare and 6 months is traveling.
Awesome.
Nice.
So, guys, I'm not joking when I say we have our own little Oprahs that come to the show. Either it's Renee or it's Rebecca. We have these wonderful Black women doing some great work around the world. And I'm so proud to call you guys my friends. So, Rebecca, I called you because one of the questions that I hear so much in all the expat groups, not just the Black expats, but just expats in general, is healthcare, you know? And the main questions, which I think I told you already, is what are the best plans, because usually expats would prefer to use a private health plan, but also, how does the public system work? Because I believe the Brazilian public healthcare system works a lot better than the American one. I'm not sure, probably not as good as the English one. People really love the HSC. HSC, that's the company I work for. The NHS, the National Health System in England. But what's the one in Canada, Peter? What did they use for public health in Canada?
Um, we don't actually have a name for it. It's taken for granted. I mean, of course
Yeah.
you get healthcare. Like it's just part of being a citizen.
Okay, yeah. No, in America, we also just have public hospitals. There's no name, although we did try to universalize it with Obamacare, the Affordable
But
Care Act.
if you make like over a certain amount of money, are you not ineligible for it?
Hmm.
Yeah. See, Canada's not like that. Although I have to say the one thing about the healthcare plan in Canada that's really fucked is that it's under the auspices of provincial governments. So what your healthcare plan is in one province might not be the same in another. So
I
some
got you.
medicines, some treatments that were covered where you used to live might not be covered in another.
I got you. So, Rebecca, can you give us, just to begin, a breakdown of that from your view? How does the public healthcare? I think we should begin with the public healthcare system. How does the public healthcare system work in Brazil? What are the positives of it? What are the negatives of it from your view, from your experience? Really, not just your point of view.
Yeah. I have been work with public health, yeah, a long part of my life because I'm infection disease, and this is the most common you have in the public care and also in the private now after the pandemic time. Everybody wants you some infection disease specialists for work on that.
Hmm.
The public health, the SUS, we call that SUS, Sistema Único de Saúde, like unique system of health.
Yeah,
It started like in 1989 for to be free for everybody, to support everybody, like we don't need to pay. This is good because they decentralize how the health system can work, like more federal, states, and municipal government. Like they share responsibility, and the people has the voice to change and to make proposal for to how it can need to work for 4 years. This is
hmm,
very good. It's decentralized, and the people has then voices and support. Uh, they has so many special program, like the program of the health of the family, like everywhere where do you live in Brazil, you can have access to primary care for they make the prevention, everything can be free. They do so many assistance on that, and I have been working also in places with indigenous like in Amazonas, with quilombola, with black people who live in villages, also people who live in the river, and we support them with the boat, with dentists, with plan, free plan for the people for go to the hospital or for rehabilitation.
Hmm.
And it's work. Now I can see with this actually government, with the actual government, they reduce the cost, also how they pay for the public health. Like for 20 years now in Brazil, we cannot increase the price of the public health care of the government.
Hmm.
It's happening before the COVID time. That's mean now, like they don't have so many resources to work, and after the pandemic time, everything increases the price. For you, have
When you
like
say, I'm sorry to cut you off. When you say increase the price, because it's free for people using it, do you mean,
Yeah, how can you
um,
increase the price of something that's free?
yeah,
okay,
what do you mean by that?
it's free for the population, but the government needs to pay the bills. For example,
Ah, okay.
Mm,
electricity, yeah,
I
they
got you.
need you to pay the exams, they need to pay everything. Like the government need to pay the bills, need to buy medicines, everything. And this
Ah, okay.
everything has increased. Vaccine,
Hmm.
whatever. And it's very hard for the work because now the population don't have money to pay
Hmm.
private, and they go for the public health, and the public health is full and don't have so many resources. That's the big
Right,
issue
so
now.
it's really understaffed, wouldn't you say?
I
Would you
agree with
say
that.
that
Yeah,
the
not so
public
many
health in
people
Brazil
working.
is, yeah, yeah. I think one of the biggest complaints people have about public health in Brazil is that it's really understaffed.
Mhm.
Yeah, there's not enough doctors, not enough nurses. Is this true, Rebecca?
I don't know. I see. Of course, everywhere the people you complain about people, yeah, resources woman because they need so much. How is the
Hmm.
public? How is public? They don't have so many concursos, so many tests for the people work for the government. Also, the actual governor he stopped to do so many tests for people work for the government because when they talk about HR, it's so much money also, and they don't want to
Yes.
spend money. And of course, they need you to pay very well. When you're
Hmm.
talking about public health in Brazil, we are talking about a good system. We has a good system. We has a good education for nurses, for so many specialty is good quality. Like when you're talking about São Paulo, is a high quality, is very nice. Like we can confident about how they have been work.
So that
But
brings me to, oh, go ahead. I'm sorry.
yeah, but that's it. The people need money. The people want you to have a better salary, and they go for privacy and also work in 2 or 3 hospital to make money. And this is insane for me.
Wow, wow.
Yes. Yes. So that brings me to a question that some people have, which is this, okay? And it's a little bit of why we met because we went to Brasilia. I think it was due to lack of access to SUS for, well, gay people, trans people, people that lived in the in the campo, you know, in the countryside, people that lived in the quilombos. So, um, how how is it when you get out of the big city? Because I agree with you. Like for certain things, man, it's fast. I'll go to Sus. I have zero problems. But I live in São Paulo. It's a major city. It has better infrastructure. I'm sure in
Mhm.
Rio or maybe Belo Horizonte, other big cities, Curitiba, it's probably not an issue. But what about if you're an expat and you're living in the little city in the countryside? What can be some issues for people like that?
Okay, I totally agree with you. I have never had any issue with the public health. Yeah. Part of my life, I use the public health. This is my first choice. And in
Yes.
second time, I use the private. But when
Hmm.
I do this, like I take longer and I stay like 6 months, something like this, to do some checkup and after. I left them because it's only to spend money. It's the same doctors and
Yeah.
same quality of health like this. Only save money for if I need some emergency, something like
Hmm.
this. Uh, I think it's very important we understand where everything is free in public health in Brazil. First, where do you live? Is contact where is the UBS in English? In
Yes.
Portuguese, we spell UBS,
Yes.
Unity Basic of Health, Unidade
Okay.
Básica de Saúde.
Yes, I'm
They
putting it
do
on the
all the
screen.
prevention for you.
So,
All
so
the
very quickly,
prevention.
very quickly, just so people understand this, guys. So when you put UBS, it's like a station. It's like an emergency station that you can go to. Look, I put UBS here on Google, and it's giving me all the ones near where I live. I have one very close to my house. So this is very important. If you have an
But
emergency,
but this is not emergency,
Yeah,
baby.
I think I did
This,
too, actually.
yes, this is basic support. Basic. This is for
oh, am
the
I
do
confusing with the
prevention.
Pronto Socorro? Right, I'm confusing with Pronto Socorro.
Exactly. This is for
I'm sorry.
prevention. You have a dentist, you have a vaccination, you have their social service.
Yeah, this is where I got my last shot. Yeah.
Mhm.
Good. See, and that's why,
And
guys, we have Rebecca on and
Yeah.
not me because I will confuse things. But so
Yeah, because we don't
UBS,
know what the fuck we're talking about.
yes, exactly. So UBS, I'm just reiterating, Rebecca, just so people get it. As
mhm.
Rebecca said, UBS is for your basic services. You can get your vaccines there, but same thing works, guys. Like she said, put it on Google UBS, and you're gonna get around your region. And you can see here I have one, two, three, four spots that I can go to a UBS. So go ahead, Rebecca. Continue. I'm sorry.
And some of them they have some system the how can I say health promotion. They go in your place, they go in your house and they say, hey, hello, how are you? How is everything? For they take care of yourself. And
Hmm.
you can take medicines free. You can do prevention for female like Papa Nicolau, some gynecological prevention. Take care of your child. Also, they do everything, and is very strong because the men of this UBS are nurses. The
Hmm.
nurse managing has doctor, they can schedule some appointment for you, and it's very nice. It's working
Yes,
very well.
for sure. I know I have gone to
One
UBS. I go
one
to
thing
UBS.
I one thing I want to ask that we were talking about that Phil brought up is about how it depends on where you live. And I guess you're familiar with the situation with COVID in, what was it, Manaus, where they
Mhm.
had like one hospital with intensive care facilities. And it made the healthcare system in Brazil look really bad. Like
Mhm.
the biggest state in the country wasn't able to treat a serious infectious disease. Like, what do you think the problem was there?
Okay, I will explain for you more or less what's happening there. I have been working there. I opened some hospital and I support some hospital in Amazonas. For you understand more or less the context, uh, is very big. The state is very, very big. And the people live far away for to find uh, high care like hospital care, for example. and they must to coming by
Yeah.
plan. And
Yeah.
when the people was very sick, they arrived late and the hospital was full. But remember, we are talking about Brazil, where you have a budget president. So sorry for that, but I must say he doesn't care about the community, about the people in the north of the country. He wanted to kill it. And he was doing a test for say, hey, if you do somebody everybody sick quickly and we can recover and we can fight against the COVID quickly. And this idea he used it in Amazonas also. And that's the reason
Hmm.
the system of health, the hospital was full. When you're talking about
Hmm.
Manaus and Amazonas, we are talking about tropical medicines. They are reference in the world how to take care about tropical medicine and how they have so many infection diseases, doctor also.
Hmm.
But we has a president who doesn't care, saying don't problem, use this, do it, and that's the reason the system collapsed there.
Yes.
Yeah,
Yeah,
there
that was
was actually a prevailing mentality that everybody in Amazonas got COVID, so they were immune. No, turns out you can get it twice, three times.
yes.
Mhm.
No, that was a clusterfuck. So moving on, Rebecca. So you have the UBS, and then I mentioned a little bit the Pronto Socorro. So what would that be?
Exactly. If you have some emergency, like some quickly, you need to go now to the hospital. You need to go to Pronto Socorro. Yeah.
Okay, I put that on the screen. There's a bunch here, as you can see, near
Mhm.
where I live. Go ahead.
Yes, they are doctors and nurses. They are gonna to do the triage and they are gonna to give you the medication and support you for emergency. Yeah, this is not the UBS. They are not gonna do prevention. No, they will support you for emergency care. If you have some accident on the way, on the road, the SAMU, the emergency car, ambulance, they are gonna drop you there in the pronto socorro. Pronto socorro do the triage. If you need some support in the hospital, they are gonna send it to you to some hospital and what do you need, and then you manage all the places for you, where you be better, where you close, and how you can support you, where they can support you.
Guys, the SAMU that you're speaking about
Okay.
is the hospital buses. Some people, even Brazilians, don't know this. I just took a course, Rebecca, 2 weeks ago, 2 weekends ago, which was for first aid, first care. And one of the questions that the guys kept saying, okay, guys, you need to remember the number for the hospital. So it's 192. So if you dial 192 on your phone, it's like dialing 911 if you are in
It's
America.
usually built into your phone.
Yes, it's built into a lot of phones, emergency. Even if you have no signal, they'll have this thing say para emergências, just for emergencies. And you call it, you have the fire station, you have the ambulance, you have the cops. So 192, guys, is the number that you need to dial if you want to get the hospital van to show up. What is the UPA, by the way? What is UPA?
Is the pronto atendimento, like is the pronto socorro. Unidade
Okay,
de pronto atendimento, yeah. Is the same of pronto socorro.
cool, guys. And like I just showed with the UBS, what you do, guys, is you just put it on Google, Pronto Socorro, and you see here it's showing all the ones that are near my house. I have one walking distance from my house. I have one, and I've been there a couple times. And like Rebecca said, it's for emergencies. So I remember I was there one time, and man, a guy came in and his leg was messed up. So, just be aware that you're going to see some things in there that are real emergencies. He obviously had a accident on the road or somewhere and it was not pretty. So just be aware that that happens. Sometimes, yes, it can take a while because they're going to go with the high. emergencies first. I think the longest I waited was like 2 hours, maybe three. But other times I've been in and out in less than an hour. So it depends a
Yeah.
lot on what day you go, when, and what's happening on the
Yeah.
roads and everything. Uh,
Can I
Great.
give you other tips? Can I give
Yeah.
you other tips? Like
Of course.
the system will be
Sure.
easy
Yes, of
and
course.
and
That's why
quickly
you're
when
here.
you know more or less what to do and where to go. For example, if now
Mhm.
you have some issue like eye issue, for example, you cannot see very well, you have some eye issue. If you tap here in Google, clínica for olho, emergência, emergência para o oftalmológica, for example. I think this is coming some private, but you put it there, go emergência, ó, hospital do olho.
Maybe SUS,
Uhum. Ó,
Hospital dos Olhos, Clínica dos Olhos.
exactly. They are free and you find what you
Okay.
need. If you are female like woman, you write hospital for woman, hospital for male, hospital for transsexual, for
But
homosexual, you
but
will find.
but in Portuguese, right?
Yes, it's
Yes,
better. I
must
mean,
you write.
Right. Right.
yeah.
So this is one thing I really wanted to ask you about is what if you were someone like myself who is totally hopeless with Portuguese and let's just say you find your I don't know, maybe your liver is failing, for example, and you're gonna die in a matter of hours if you don't get immediate medical attention. What are your options?
192.
No, yeah, 192 or
But
go
what
to
but what do
Google.
you say to them? Right? Like an
Yeah,
emergency number is no good if you don't know how to describe
it's
your
good.
problem.
It's very good. The emergency number is very good. They go so quickly
What you
everywhere.
have to say, what you have to say, uh, uh, is "Estou morrendo." I'm dying. That's when
Okay.
Google Translate comes into play, Pete. I mean,
Okay.
there's not
Yeah.
much you
Yeah.
can do. You just gotta
Yeah.
use your Google Translator and make sure you know some phrases like "Estou morrendo,"
Yeah. I was
"Ajuda,"
thinking like a Judah Mim. A Judah Mim. Like,
"Ajuda,"
oh,
"Me ajuda," "Me
yeah,
ajuda."
help me,
Yeah,
help me.
yes, because then it's just a language thing. You have to learn some basic Portuguese, guys, to survive here, and
Yeah,
then Google Translate the rest of the way. Google Translate's improved a lot since I first came to Brazil. It's actually pretty,
exactly.
90% of it it'll get right.
Yeah.
So yeah, that's what you do. If you guys have an emergency, dial that number. I remember I had an emergency once, and I didn't know about the SAMU. I just called a taxi. I found I went to Hospital de São Paulo, which is a very nice hospital in Santa Cruz, and I lived in Moema at the time, so it was the closest public hospital, and I just found the address and called a taxi, and this was before Uber. So, and boom, I was there. So then you
Yeah.
just use your little Google Translate.
I'm lucky. People usually call an ambulance for me because I'm like, oh fuck, I'll be okay. And they're like, dude, you need a fucking hospital, and the ambulance comes. So I've never actually had to be in that position. People call it for me. They're like, no, dude, you're not okay. You need a fucking ambulance.
You need an ambulance. Let me just say hi to some people before we continue. First, Sidowsley first.
Travelmatic.
I have Travelmatic, who's a big fan of Rebecca. So he's on here. What's good, fine people? My friend Jeffrey, which I miss very much, but he's taking care of business, so the love persists, although he's far away. He's in the building. Good to see you, Jeffrey. And we're having a little discussion here about healthcare. Now, we're getting into all these details, which I love, Rebecca, but let's go. I'm going to take it back a little bit because can a foreigner get a SUS card? That's a question a lot of foreigners ask. How do I get a SUS card? How do I get in the system?
Yes, can. Foreign, they can have a SUS card and only go when you arrive in the public health. When you arrive there, they will find a way for to introduce you in the system. like because they need to give it to you the help and
Hmm.
support. That
Yeah.
is very easy, and then you are gonna to do only what you need is your address. But if you don't have address, don't worry, then you find a way for give it to you your number and assist you. This will not uh, take you out for don't have the care. They will support you because they need to do it.
Yes. So, in other words, folks, just show up. They're not going to turn you away because you do not have a SUS card. But then, like Rebecca said, they will find a way to put you in the system. Oh, I just deleted the app because it was on my phone. I had the SUS app. But after you get the card, there's like, you can go to the um, electronic card. It's SUS. What is the site, Rebecca? It's uh,
SUS.gov.
SUS.gov, something like this. But if you go on Play Store, it's Connect SUS, Connect SUS. Yeah, I was trying to open it here for whatever reason. It's bugging. I
Is
only get a
because
white page. Yeah,
because the government, my friends, he doesn't care about your health.
I agree. I agree. But on the Play Store, if you go to Connect SUS on your Play Store on your phone, you will be able to download the app. It's very easy, and then everything's just online because I'm terrible at keeping cards. I do have my SUS card in my wallet, but but like Rebecca said here, I don't know if you can see it very well. It's tough to show phones on the screen, but yeah, just click on that Connect SUS, press install, and you are in business. Um, so okay, so you have the UBS, you have the Pronto Socorro, you have public hospitals like Hospital das Clínicas here in São Paulo, Hospital de São Paulo, which I went to, and
Yes.
um, now one complaint. Let me know if this is an issue that needs, some people have. What I hear some people say is this, Rebecca. If you have an emergency, if it's something, you broke your arm, et cetera, SUS is the place to go. If it's something longer, like imagine you have cancer or you have some type of degenerative disease, sometimes that's where I hear the complaints where they say, man, the lines are very long. It can take a very long time to get treatment. And I'll share a quick story that kind of kind of proves this a little bit. I remember back when I lived in Moema, this is 2014 or something. I went out with my brother, my big brother, and we were on Paulista. It was the weirdest thing, Rebecca. I felt like a wind go in my ear, and I started to get an ear pain, very sharp pain, very like it hurt. It was like somebody was putting a ice pick in my ear. And then I went to the SUS. I went to the thing, and they said we can see you in 3 months. I said, I'm not going to survive 3 months with this pain. So, in that time, what I did is I found a little clinic. I paid 100 reais. The lady fixed me up and ended up, it was a buildup of wax. I don't know how. I've never had this issue in my life, but apparently I got it
It
here in
happens
Brazil.
in pollution heavy cities.
Oh, that's
I had
probably why
I
then,
had the
because I
same experience
never,
in Beijing.
yeah, I never had this
Yeah.
issue before. And it was like I was in there 10 minutes. She put the turkey baster with the warm water in my ear. It was gone. Boom. I was not going to wait 3 months to get this fixed. Like it was
Hmm.
making my jaw bleed. It was hurting so bad. So I think I want you first to give your a view of this issue. And maybe this could be a bridge to get us into maybe the benefits of having a private health plan in case of things like this. So what do you say, my dear?
What I say is I have been working with this cancer disease, hepatitis, people with HIV, so many of diseases few
Mm-hmm.
years ago in Brazil. And I think after 2 years or 5 years in Lula government, they did in 30 days, they must start to do the treatment of cancer. Is
Mm-hmm.
obligate. Yeah, maybe this history you are talking like is more than like is years ago, but now it's 30 days. They must start the treatment, and it's free. Like you don't need to pay, and it's very expensive, the chemotherapy. Like
Yes.
we, what you told in the beginning of our conversation was, hey, how is the better plan for we use? Yeah, our time is when the private system, private health system, they cannot pay. They go for the SUS. They go for the public health. For the public health, pay them because everything is there is free. For example, the famous in Brazil, Marcos Mion, for example, he has a son, he has a disease, and he used the system, public health, for taking medicines free from the government, and he go for the private. Understand, like you can have some benefits because in the public you find the high level of the medicines and it's very expensive also.
Hmm.
I got you.
That's
But
it. Like it's very common, but you need to take care. Sometimes take longer, but if take longer, you can go for social workers in the hospital has so many, and they can to do it more quickly and in a more properly way when it's take longer.
but the expense varies depending on how long term the treatment is, right? Like for example, Phil's situation, it was a quick fix. So it was actually easier for him to go to a public clinic and just pay 100 AIs and be done with it. Whereas the situation you're describing, it's like, okay, long term treatment, it could take months, it could take years. In that case, private's probably the better option. But if it's an emergency, would you still recommend public health care over private? If you could afford it. I mean, I understand not everyone can afford it, but if you can afford it and it's just like a one-time thing, is public or sorry, private better?
Yeah, I can see like it depends. When I say depends, depends so much where do you live?
Mm-hmm.
Hmm.
Yeah, like for example, if now I don't have a private uh, health care, for example, if I am sick, what can I do? Understand, like I'm living in São Paulo, I know they have good hospital, they have so many university who have like some doctors free attend, everything is nice, like are you asking for that? But if I live far away, far from the town, some places I will never do that
Mm-hmm.
because I know it will not be work. This is not to be very well because it will take longer. So many people in the line. But I have some friends and family. They are in treatment for cancer in SUS because it's better, and they have like they pay for the private health care, but they use the SUS because it's more cheap. It's not cheap, it's because the quality is better and they provide everything. They provide the transport to move from some city for the other city. And my friend now, she was his the father of her husband, he was very sick, and she called me, hey Rebecca, I say go there and talk with the assistant social, the social worker. And in 1 week he was doing the surgical. Understand, like need to explain,
Great.
need to go there, you need to as a properly people who can support you and explain what you need exactly.
I got you. I got you. So overall, guys, there are benefits to SUS, many benefits to SUS. I'm a user of SUS, and I've gotten X-rays with SUS. I've taken care of some other health issues with SUS. Um, but I started working in a high school, Rebecca, maybe it was 5 years ago. And one of the benefits of working in a high school is that they sign you up for private health care. And I will say, I was pretty impressed with the private healthcare system here too. But like you said, it's a lot of the same people that work, so maybe that's why. And I saw the benefits of the private healthcare system. It's expensive, but what you can do and what most people do is they get a plan. They get a plan through an agency. I'm gonna post some of these here so you can see, and then Rebecca can talk to us about it. Um, for example, here, there you go, health plans. Okay, and here there's a ranking. I don't know if it's, but Notre Dame is number one, and I hated Notre Dame. Uh, we
Yeah,
used to
me
work
too.
with Emil, and I loved Emil. I thought Emil was amazing, but it got too expensive, I guess. And then our school changed to Notre Dame, and Notre Dame was a pain in the ass. You know, we don't like it at all. But so guys, these are some of the most popular healthcare plans in Brazil. So you have SulAmérica, Bradesco, Golden Cross, Unimed, Assim, Allianz, Caixa, and Salutar. So, Rebecca, I know your heart is in the public sector, but can you tell us a little bit about the private sector? What are the benefits of the private sector? What works, what doesn't work, etc.?
Yes, I have been working also in the private centers. And it's very hard, like for me, when you work like for them because they want to make money. Yeah.
Of
Everything
course.
will be money, everything will be cost. And I totally agree with you. If Notre Dame is not so good, and now I don't know why they are in the top of the list.
I don't know either because Notre Dame, oh my God, that was hell. July
They
for
they
me, guys.
probably paid for it.
Oh, no, well, yeah, it was free for me because, I mean, not free because they take it out of my salary, but uh, Rebecca, July is my vacation month. I mean, I work in a school, so July we're off. Man, I did not enjoy one
Hmm.
minute of my vacation. In Notre Dame, the problem with it is that every clinic was on the other side of the city. I had to go to Osasco one day. I had to go to Santo Amaro the other day. I had to go to Santana the
Oh
other day.
God.
It was horrible. And with them,
Mhm.
and it takes like an hour for you to schedule. Like on the app was horrible, and then you call a number, and then you're on hold for 30 minutes. It was really a long process. I figured out a little trick for anybody that does have Notre Dame is that they have some laboratories that they're partners with. In Lavoisier is actually a very good laboratory here for exams. So I called direct to Lavoisier and told them I'm with Notre Dame, and that was much faster. So that's my little trick in case you do have Notre Dame. It is cheaper. That's why people do have Notre Dame. A meal was like next door. I could find these clinics next door when I had a problem with my eye, like I had dust go in my eye 2 years ago. Man, I went to an eye doctor like next Tabuão. I live in Butantã. It's like right next door. So I enjoyed that experience a lot better. A meal got a bit more expensive though, so I understand why our school changed the healthcare to Notre
Easy.
Dame.
Yeah.
But anyhow,
Yeah, Notre Dame is very popular now. Like
yes,
popular, and when you go, like when you told Osasco, Santo Amaro, is like your region has so many people, and when you
yes.
go there, it's full of
Oh
people
my
going for the to pass with the doctor. Like it's terrible.
God, Rebecca, I
Yeah.
thought
So
I was in a.
doesn't that make being popular a bad thing? Like if it's popular, that means everyone's using it, and you're not going to get enough attention.
Well, it's popular because it's cheaper, too. So, because popular, I think Rebecca, correct me if I'm wrong, but I think it's maybe the way from Portuguese to English. Because here, when we say it's popular, it's like for the common folk. It's like the working class. It's very
Yeah,
popular in that way. So when we say um carro
but that's
popular,
everyone.
yeah, it's like for the people. It's like the people's healthcare. So. Yeah, so Rebecca, when I went to schedule an exam, I walked into the Notre Dame. I said, "Oh my God, I feel like I'm in the Pronto Socorro." It was more people even than and I
Yeah.
waited, and then finally I saw the doctor for like 5 minutes, and he just gave me all these exams to take. and then I had to go. It was
Mhm.
like I took a tour of Sao Paulo. It was incredible.
Mhm.
Um, but when I was with Lavoisier, because I got tired of the places that they were sending me, so I just went direct with Lavoisier. I give them high marks. I really like Lavoisier. It's fast, it's efficient, the doctors are great. I have zero complaints. So that's my little tidbit about Notre Dame. Emile, I had zero complaints with. But go ahead.
Mhm.
What if somebody's getting a healthcare plan? I'm going to give Rebecca the $1 million question. If a gringo, as they say, the expat, needs to get a healthcare plan, which one would you recommend? You that are in the know, you're in the inside woman.
Yeah. A meal is good. They are very expensive, but they are long time. Like they are working for long time and the best hospital around Brazil.
Hmm. Yeah.
The second, that don't mean like it's very good, but Unimed is also good. Is not bad. Like you can use, you can be safe. Like this is the top of, like I can tell you, like for me, only this two.
Yeah, and guys, when she says expensive, I mean the thing, if if you have some expats that are dealing with dollars, it may not come out as expensive if you're dealing with dollars. It's expensive if you're earning in reais.
Yeah,
Because I was
no.
looking at the average price, it's like
We
300.
know some expats who are making pretty good money.
Yes. So we're looking at between 300 and 500 reais a month, for a meal nowadays, for like the basic plan. Um, and that's okay. That's going to be what in dollars, $20, $30 a month. So it's not super, super expensive if you're
Yeah,
dealing with
How
dollars and
much per month did you
thanks
pay
to
the
the
rent?
value currency.
before, because they raised the prices, but it was between. Look at this here. I got a little screenshot here. Let me stop sharing and go here. And I put the prices for a meal. We got between 343, 329 reais. And then it just goes up from there.
And
But then
also
again, guys.
you need to inform your age. Yeah, for you
Hmm.
know more or less
Yeah,
how much
so
it will cost.
there you go with the age from 29 to 33, 800 reais a month. You know, what is the cheapest plan? It's the Emil 200 is the cheapest plan. So, but you're looking at around that price, folks. Well, no less than 200 reais a month for a decent healthcare plan. Then you just got to do your currency exchange and see how much that is. Um, Travelmatic asks here, what would you call expensive? Again, a Travelmatic. I earn in reais, so whenever I think about money in Brazil, I'm thinking expensive is 300 reais. I don't have 300 reais to spend every month on a healthcare plan. Some
Yeah, but
folks
it
are.
is so basic. Like
It is the
how much?
basic, exactly.
Yeah, like
Yeah,
this is nothing. Like how
exactly,
much I was paying was more or less like $150 per month.
exactly.
150.
Yes.
Like for to have like so many hospital, something like this is.
Mm. So for the average Brazilian, that's expensive. 300 reais a month. You're not gonna have it. Notre Dame is a little bit cheaper. Let me see here. Let me put Notre Dame preços. Notre Dame. Quanto custa um convênio? You see how it's a little bit cheaper here, even for all. It's if you're a child between 128 reais, and as you get older, of course, it's gonna get a bit more expensive. But let me see. I'm 40, so yeah, I'd pay between 200 or so. I'd be in this line right here, which is a big price drop from the Emil, but you pay what you get for, or you get what you pay for. I meant to say, right? And for the average Brazilian, that's expensive. Okay, so that's why SUS is a great option. But if you're earning in dollars, okay. a basic plan for 3 or 4
Oh,
million
for
reais,
example,
you know.
here, oh, if you want, I can share also my screen. Yeah, that's it.
You share your
Ah, yeah,
screen.
go there, go back, go back, go back.
Oh,
Your screen, how it was there.
1 second.
You need to see your age, yeah. And here, how is this? Is a meal?
This is Notre Dame.
Notre Dame, yeah. Because yeah, meal is very like what I know is like between 250 at 2,600.
Yeah, no, for sure.
That's
Look at this. This is a
that's a
meal.
lot for the average Brazilian.
Look, guys, this is the Emil table of price. So look, for the same one, I'm about this age. I'm right here. I'm at this age. So it's 100 reais more from the most basic to then the most, the a bit more exclusive. And if you get older, then if you're over 50, good luck. Because that's
Hmm.
expensive.
Yeah. What's the one they have that's just for old people? The what is it? Senior.
Senior Magi,
I
I think
forget
it's
what it's
something like
called.
that. Is there one for health plan for
Yeah.
just older people, Rebecca?
Sorry?
Is there a health plan for just older people?
Yes, they had, but after the COVID time, they was working together with to kill these people, and they are not more a recommendation to
Oh
use.
my God!
Yeah.
Hmm.
Yeah. Don't need a
Yeah.
health
Don't
care
go
plan
to
for older people because they're all gone.
Prevent senior. If
prevent
you write
That's
there,
senior.
it.
prevent
That's
That's
it.
senior.
Yeah,
yeah.
yeah. That's the one I was thinking of. It's the one my friend is on.
Mhm.
He's well,
Oh
ex-friend,
man.
but he's like an 80-year-old diabetic in a wheelchair, and yeah, this is where he's getting all his healthcare treatment from. But since he's not my friend anymore, I'm glad to know that's the program he's on.
Oh no, that's terrible. Just but there it is. Prevent
Yeah.
senior. It's still there. It's
Mhm.
still there. It's still there. It's
Yes.
still. But be careful. Their
Be
healthcare
careful.
plan is to
They will
make
kill you.
space. Yes, make space for
Yeah.
younger people. That's their healthcare plan. Um, so so guys, to get a private healthcare system, then you do like we were just doing. You get the company, go on Google, click on the site, see which one benefits you, and it's just like buying a pizza, whatever. You got to go through the process of getting all the paperwork done and getting your credit card out. I would suggest getting a Brazilian to help you if you don't speak good
Hmm.
English, so you see or good Portuguese, so you see which plan best works for you. Because some of the stuff for the more expensive plans, it's kind of superfluous. It's like you can get a private bed if you go to the hospital, or one you're only going to be in a room with another person, or another one, it's able to go to the top hospitals. Man, most of the time you don't need that. You just need a place in case you,
Yeah.
like me, like I was running and down, and I got a truck passed by and dust went in my eye and I got pretty screwed up because of that. So I went to the health thing. I went through the healthcare, got the lady to scrape it out. It was the most excruciating experience of my life, but got it taken care of. You don't need all the extra stuff. You just need
Yeah.
if
What
you
you
really
should have
want to
learned
go.
from that experience is don't run.
Well, don't run without glasses. That's why I buy a lot of the
Yes, yeah, exactly. Yeah.
yeah, because when you're running down the highway, you that has a tendency to happen. So now I have running glasses. But great information. Um, and I think that's about it. I don't want to extend this longer than it needs to go. I think you gave a lot of
Yeah,
great
we're keeping
information.
Rebecca up way past her bedtime.
Exactly. And
Out
Rebecca's up late,
there all
guys.
the way in Sierra Leone.
Yes, she's in Sierra Leone. But before she goes, let me get her site up here because I love her site. Guys, Rebecca's not just a nurse, she is a world traveler. and other Tonga Travel. They went up there. Okay, and tell us a little bit about Bitonga Travel. Come on.
Yeah, Bitonga Travel is a group of Black travelers around the world. We have more than 200 Black travelers producing content for traveling and share experience. And
Nice.
that's it. We has a podcast, we has the website, so many activities. And now we are gonna do a travel for Quilombo, 20th of November. Will
I think
happen,
I'm
will be very
going.
nice. A trip day. And also I'm producing a travel to Afropunk. We are more than 20 black women traveling there, and I also invite you to come in there and to go for some places, to visit exclusive places, restaurant, dinner, and tour. Talking about Afrotourism, you are most welcome.
I am looking at this restaurant list, man. I think I am going to some of these. It's cool that you're giving the top 10 restaurants, but they're all not Brazilian food. So that's pretty cool.
South
Is that
American, all the South America, you can travel
South
all
American?
countries in South America in restaurants in São Paulo. I wrote
Yeah, look
this
at
text.
this. You
It's
got
very nice.
Venezuela, Uruguay,
Mm.
Chile,
Peru,
Peru,
Mm.
Paraguay, Ecuador, Chile,
Peruvian
Colombia.
food is
Ooh, the
so
Colombian
good.
one looks delicious. Bolivia, I've never had
Bolivia,
beef. Argentina.
Argentina.
Oh, this is awesome. So I already that was the first thing that caught my attention. I already saved that page. So like and share the Jeff, we should hire him because I always forget to say this at the beginning of the podcast. Guys, like and share. Please like and share. Yes, Jeff is my manager. He takes care of business for me. Thank you, brother. Please like and share. This is important information, though. So I really want to thank Rebecca because this is probably the most asked question. Probably the second one is how do I open a bank account in Brazil? But first is
Yeah.
always healthcare,
I
healthcare,
still
healthcare.
don't know the
What is
answer
it?
to that question.
Oh, the bank. I can talk to you about that later because I'm helping a friend do that. Um, But with healthcare, because yeah, it's a different country, man. You want to be safe. Just remember, I think important thing that Rebecca said: if you go to the public healthcare system, don't stress. Oh, I don't have my CPF. I don't have this. I don't. Man, it's their duty. It's the Hippocratic oath. They're gonna take care of you.
Yeah,
Okay,
I can
um,
actually vouch for that.
for sure. Yeah, because
In
you have zero
in my
documents until
experience,
recently.
yeah, I have nothing. I just get carted off in ambulances and they drag my ass to the hospital and they fix me up and I'm on my way.
Yes, it's like yeah, it's the gringo again. Everybody knows Pete in the hospitals, and I agree, guys. I have a health issue that's long term, and I go to I guess it would be a UBS, and it's wonderful. You know, I go there, I have zero problems. I'm in and out. Whenever I have I got my X-rays, like I said, at Hospital Sara here close to where I live, which was super fast, super easy. When I've had stomach problems, which is my ongoing issue in my life, I've been down to
Ugh.
the pronto. I've gotten antibiotics for other stuff. You know, when we're partying a little too hard and we're putting our genitalia where we shouldn't, I've taken care of that through the pronto socorro. But I also like the private care, especially with a meal, nothing dumb, or like, up and down. But Lavoisier, I really recommend as a good lab if you have the cash for it. Rebecca, any last words, my dear?
I would like to say thank you so much. Thank you so much for this invitation. I'm here all time. If you want to chat with me, talk to me, you can contact me in the Instagram, Facebook, by email. You'll be very, very nice. Okay? Thank you so
Oh,
much. And
Rebecca, yes, please, before you go, I'm so sorry. But guys, please follow her on Instagram. Let me put it here so everybody can see. Rebecca Alatea. But guys, I always link everything in the comments, so don't stress if you forget it. But there she is. There she is. And from here, you can get to the Bitonga Travel page. You look at these beautiful pictures. She's all over the world. She's amazing. She's got a book, okay? Right Living that you can buy on Amazon. She's everything. In fact, Rebecca, I want to extra thank you because really, Pete and I were going to have you back to do a part two of places to travel in Brazil. We're going to save that for later, but thank you for coming
We can
on
still do it.
emergency style. Oh, no, we're still going to do that one because I love the first one.
Mhm.
But she came in emergency style with the save for the healthcare information because if it was me and Pete giving you healthcare information, yeah, you don't want healthcare information from us.
Yeah,
Rebecca's
exactly.
Pete's advice is just wait for somebody to call the ambulance.
Yeah, that's basically it.
Yes. So thank you, my dear
But they will take
folks.
you
Thank
to the cheapest hospital, though.
Yes.
You don't have
Oh,
to pay for the ones that the people call for.
and
Don't
remember,
need a
you're in
healthcare
Brazil.
plan for that.
And remember, guys, you are in Brazil, and Brazilians are fucking amazing as far as helping people out. So if you are in an
Hmm.
emergency, ask for help. A Brazilian will help you. They are wonderful for this. Okay. Um,
Yeah,
Excellent.
Pete-
they might empty your pockets while they do it, but they will make sure you're okay.
oh man. But anyway, here we go, guys. Outro music. It's been a while. I'll promise to not take forever. In fact, we may have somebody on next week or the week after talking about life in Paraisópolis. He's a guy from Chicago, I believe, that lives in Paraisópolis, black artist doing his thing down there.
Shit.
Um, yeah, no, cool guy. So that's it. Thank you, everybody. Kisses, as they say here in Brazil. Until next time.
God bless you, Rebecca. So happy.
Bye. Bye
And I want
bye.
an
Thank
invitation to one of
you.
those restaurants, too.
Oh, we're doing it. We're
Love.
doing it.